Hi friends, we are back with another success story of one of our patient who had heart blockage. He had multiple blockages in heart. Generally, it's a condition where the plaques are built up and for which stent is placed in modern medicine, which is the most prevalent disease of the leading cause of heart attacks in these days. These are the cholesterol or the plaques and the calcium is deposited in the coronary arteries of the heart, which restricts blood flow to the heart and that leads ultimately to the heart attacks most of the cases. Here it's report before starting our treatment, he has been to some other hospitals for sake of the treatment where he was diagnosed with this CAD, coronary artery disease, and he was detected with the multiple five blockages in his heart and totally six if we include stenting, uh, in which there were more than 95% blockage. So if we will exclude that here, if we exclude, there are about total five blockages. One was in LMCA here. Uh, Here it is. It was one blockage out of five, and here in LAD there are two blockages. Length of one blockage was 26 before commencing our treatment, and it was almost more than 80% block in LAD. Length of the blockage 26 and calcified plaques causing stenosis. It was 80 more than 80%. And the third blockage was in the same LED and the same artery, and it was about 1.7 length. And another one was in ramus, luminal stenosis. Here in ramus, and after the in L6 there was a minimal luminal stenosis. Of mid segment noted. So 1, 2, 3, 4, 5, and another one was already stented. The stenting was done in that RCA where there was more than 90% or the generally we do not take more than 90% blockage cases for that's emergency case or would send them for the cardiologist. But if any block is less than 90%, we could dissolve it with the help of medicines. So total five blockages were there. 1, 2, 3, 4, and this one was the five. This was his report before commencing our treatment, and if you look from the close, I will zoom it. Yeah, first one was in LMC. These are all the blood vessels of heart that supply some blood to our heart. The major arteries of the heart, and this one was, if you look from the close, LMC and luminal stenosis 80%, 26 mm, 1.7 mm. In ramus 30 to 50%. Minimal stenosis and LCX. There was a stent in one artery, that was an RCA, and this is after our treatment of 3 months, and was left with the just blockage in one artery, but there were the two blockages in the same artery. But if we notice the difference, the length of the blockage the length of the blockage is decreased to 50% almost. Previously it was 26 mm. If we look back, previously it was 26 mm, now it's 16 mm, for which treatment is still going on. The treatment is not over yet, but because most of the patients are not following up after completing the treatment, they don't even contact us, they won't share their reports. So that's the reason we are uploading before the treatment course has not been completed yet, so that it could reach to most of the people who have been struggling with the same kind of issues anywhere. So if you want to get rid of these kind of conditions, share this video with those people who are having blockages anywhere in their heart. If it is more less than 90%, so this was before, and this was in the middle of the treatment after 3 months. So friends, these were the reports. Rest of the reports would be shared if the patient follows up after completing the treatment course, and share with others. If anyone is enduring the same kind of situation, share with them.